Hi, welcome everyone to our Cecilia Health webinar. Tonight we will be covering our chronic kidney disease and diabetes webinar. You will see here at the bottom of the slide there is a phone number in case you're having any technical difficulties, and the phone number is 800-263-6317. Thank you again everyone for coming tonight. And next slide, please. Thank you. And you'll see here with our program, it is meant to be an interactive program. And so what it is there will be a short presentation followed by some time for discussion. So you will have a chance to enter in your questions, and you'll see that here on the right, there is a question tab on the webinar toolbar. So please type any questions that you may have, and Nanette, our presenter, will be have some time to answer at the very end. And just as a disclaimer, we know that the information you are about to hear may motivate you to make lifestyle changes, but first, please do consult with your doctor before making any changes to your current routine. The Cecilia Health Registered Dietitian will provide strategies to help manage your CKD, and in this case, the Cecilia Health pharmacist will be providing the information. And this online Q&A session is intended to give general advice. This information is not a substitute for personal medical advice, and again involves the professional opinion of the Cecilia Health pharmacist as well. So our presenter tonight, everyone, is Nanette. She is a pharmacist who left retail and became a certified diabetes care and education specialist. She has been with Cecilia Health for 8 years, and in the summer she likes to volunteer at a diabetes camp for kids. She loves watching movies with her husband of 30 years, and in addition, she enjoys quilting, spending time outside, gardening, as well as bird watching as well. So thank you so much again, Nanette, for leading us here on our discussion tonight about CKD and diabetes, and I'll go ahead and hand it over. Thank you.
Thank you, Emily, and thank you everyone for joining me this evening. We're going to talk about how diabetes causes kidney disease, tips and habits to help keep your kidneys healthy, nutrients to consider when planning meals, healthy eating for chronic kidney disease and diabetes, food to limit or avoid to promote your kidney health, and meal planning for chronic kidney disease and diabetes. Now, diabetes is the #1 risk factor or cause of kidney disease. And our kidneys are made up of tiny little filters called nephrons. And there could be up to 1.8 million of these in each kidney. Now, they are responsible for the reabsorption of water and electrolyte balance, including sodium, potassium, and phosphorus. They're also responsible for removing waste products of metabolism from the blood, especially the waste from protein metabolism. Now, the kidneys filtering of the blood keeps what we need in the body and gets rid of what we don't need. Now, blood that's has too much sugar in it is thicker than normal, and that makes the nephrons work harder to filter the blood. And that can stress out kidney function and over time may cause damage. In addition, high blood pressure is the second leading cause of kidney disease. And many people with diabetes also have high blood pressure, which only accentuates the risk of kidney disease. Now, what's the best defense? Keeping your diabetes and blood pressure in control. Now, if you have prediabetes, taking action to prevent type 2 diabetes is an important step in preventing kidney disease. Studies have shown that overweight people at the risk of type 2 diabetes can prevent or delay developing type 2 diabetes by losing 5 to 7% of their body weight, or 10 to 14 pounds for a 200-pound person. You can lose weight by eating healthier and getting 150 minutes of physical activity every week. Now, tips to keep diabetes in control and kidneys healthy. Keep your blood sugars in a target range as much as possible. Get an A1C blood test at least twice a year, more often if your medicine changes or if you have other health conditions. Talk to your doctor about how often is right for you. Check your blood pressure regularly and keep it below 130/80 millimeters of mercury, or whatever target your doctor sets. Talk to your doctor about medicines and other ways to lower blood pressure. Stay in your target cholesterol range, and get your kidney function tested yearly or as recommended by your doctor. Common tests for kidney function is an estimated glomerular filtration rate, or eGFR, and a test that looks for protein in your urine called a urinary albumin to creatinine ratio. Now, eating a healthy diet, being physically active, taking your medications, monitoring your blood pressure and blood sugar are all ways to promote kidney health. Now, nutrients to think about when you're planning your meals. You need to eat enough, but not too much, of first protein, and that can be from either animal or plant sources. 6 to 8 ounces or 42 to 56 grams of lean protein per day, depending on age, gender, and size. Your kidneys remove the waste of the protein digestions from your blood. A high protein diet may not improve blood sugar control, but it may contribute to worsening kidney function. So again, eat enough, but not too much. And now sodium. It's recommended to try and limit your sodium to about a teaspoon a day, or less than 2,000 milligrams of sodium or less per day. Your kidneys control your body's fluid balance by regulating the amount of sodium in your body's fluids. Too much sodium in the diet leads to high blood pressure and fluid retention, and kidney function can decline. Potassium. Now, this is found mainly in fruits and vegetables, but also in beans, lentils, nuts, milk, salt substitutes. Your kidneys regulate the amount of potassium in your blood. Too much or too little potassium can cause muscle cramps and weakness and problems with how your heart beats. And phosphorus. In processed foods, fast food, cola drinks, chocolate, and beer, phosphorus is also found in protein foods such as milk, cheese, yogurts, dried beans, legumes, and nuts. Your kidneys might keep the right amount of phosphorus in your body. If too much phosphorus stays in the body, though, calcium leaks from your bones and causing weak bones and increasing your risk of fracture. Now, eating healthy for chronic kidney disease and diabetes. Figuring out what to eat when you have both diabetes and kidney disease can be challenging, and it may time be overwhelming. You may be wondering, what can you eat? So let's start by reviewing diet recommendations for both diabetes, and then we'll compare it for diet recommendations for chronic kidney disease. So healthy choices for diabetes: lots of fruits and vegetables, whole grain, lean protein, healthy fats, less salt, less sugar, and less refined carbohydrates like cookies, crackers, and sodas. Healthy choices for chronic kidney disease: eat less salt, focus on fresh, homemade food, limit restaurant and packaged foods, possibly reduce potassium, phosphorus, protein, sodium, and fluid as suggested by your doctor, typically in stages 3 to 5 of chronic kidney disease. Now, one thing I just want to mention on here about the lean protein. What I always remember is animals with 2 feet have less fat than animals with 4 feet. So turkeys and chicken have less fat than beef, pork, or lamb. So that's one way to think about leaner protein in your diet. Now, ways to replace salt in your diet. Now, this is just a small list of possible seasonings. If you've ever looked at the grocery store, you know there's a lot more than what's on this list. So adding seasonings instead of salt to your meals can definitely increase the flavor, and you don't miss the salt. And it's recommended to add the seasonings during the last few minutes of cooking. Basil, I love basil in Italian foods, eggs, tomatoes, chicken or fish. Celery seed is great with cold vegetable salads. chili powder with meats, stews, soups, or eggs, cumin, curried vegetables, fish, lamb, or poultry, garlic, and salads and meat, poultry, or fish. But again, there's no limit to what seasonings you want to put on what food. Now, food to limit or avoid to promote your kidney health. Limit bacon, hot dogs, bratwurst, Polish sausage. Luncheon meats, including bologna, liverwurst, summer sausage, or salami. Limit or avoid boxed, frozen, or canned meals, entrees, or side dishes. If it has a seasoning packet, that seasoning packet probably has a ton of salt. Carbonated beverages, especially dark sodas, beer, chocolate, and caramels are all things that you should limit or avoid to keep your kidneys happy. Now, all of these foods may be high in sodium, saturated fat, calories, sugar, and contain phosphorus and potassium, which if your kidneys are having a problem filtering, you don't necessarily want to add more into your body. So here are some examples of a food a person with diabetes and chronic kidney disease can eat. Lean meats like poultry, fish, eggs, or unsalted seafood. Vegetables, cauliflower, onions, eggplants, almost any vegetable. Grains and starchy vegetables, whole grain bread, whole grain rolls, pasta, crackers, green peas. Fruits, including berries, grapes, cherries, apples, peaches, pears, plums. As far as fats, canola oil, olive oil, avocado oil are healthy fats. Drinking plenty of water, unsweetened tea, and occasional clear diet sodas. So what's in a portion? When it comes to fruit, a small piece of, like a small apple, a half of a medium banana or half of a grapefruit, 1 cup of melon, a half cup of cut fruit, or 2 tablespoons of dry fruit. Dairy, 1 cup of low-fat or skim milk would be a serving. 6 ounces of plain or light yogurt, a half a cup of no sugar added pudding, or vanilla ice cream. When it comes to a serving of starchy vegetables or grain, a half a cup of potato, corn, peas, quinoa, oatmeal, a cup of gourd squash, a 1/3 cup of pasta would be considered a serving, 1 slice of bread, half a sandwich bun or a half an English muffin, 4 to 6 crackers could be a serving. And then when it comes to a portion of non-starchy vegetables, 1 cup raw vegetables or a half a cup of cooked vegetables. So when it comes to portions of protein, 2 to 3 ounces of meat, fish, or poultry, either 1 egg or 2 egg whites, or 1 ounce of cheese is considered 1 portion of protein. And fats, 1 teaspoon of oil, 1 teaspoon of butter or margarine or mayonnaise. And that's teaspoon, not the bigger 1 tablespoon. When it comes to light mayonnaise or light margarine, you can have a tablespoon of that would be a serving, 4 to 6 nuts, or 2 tablespoons of seeds. Now let's put healthy eating for diabetes and kidney disease together by using a plate method of eating. This eating plan is allowed for healthy eating of balanced meals and snacks that can promote blood sugar control and slow the progression of kidney disease. Since heart healthy eating is also a part of this plan, it can help you with that as well. So this is based on a 9-inch eating surface, and it's designed for 30 to 45 grams of carbohydrates without measuring portions. Now, this is an appropriate amount of carbohydrates per meal for most people. Depending on gender, size, and activity level, more carbohydrates could be added. Now, by choosing fresh, minimally processed and homemade food, You can limit the added sodium and phosphorus containing in your diet and focus on whole grains, fresh fruits and vegetables, low-fat dairy, heart-healthy fats, lean meat, poultry, fish, plant proteins, and learning where to place them on the plate can help you manage your diabetes and chronic kidney disease successfully. Now, by avoiding prepared foods and not eating out, cooking at home with salt-free herbs and spices, as well as using portion control while focusing on eating fresh vegetables and fruit, whole grain, lean protein, healthy fats, and staying hydrated, you can help keep your diabetes in control and limit the progress of your chronic kidney disease. If chronic kidney disease progresses, specific attention may need to be given to the amounts of protein, sodium, phosphorus, potassium, and fluid you eat to keep your kidney function healthy. And always follow the advice of your doctor or healthcare team. Now, for more information about chronic kidney disease, there is the National Kidney Foundation, American Kidney Fund, American Diabetes Association, Diabetes Food Hub, and also free webinars by Cecilia Health. Okay, and I am available to answer any questions. Okay, here's a question. I see multiple doctors. Who should be looking at my kidney function? Well, I would expect your primary care doctor to be looking at it. If you're not sure who's looking at it, that's definitely a great question to ask your providers. And sometimes with talking to doctors, you need to be specific and say, when was the last time you looked at my kidney function and what was it? Just like, you know, what is my A1C? Has it improved or not improved or stayed the same? So if your doctor should be able to tell you that. If you see a diabetes doctor for your diabetes, they should also be able to answer those questions for you. Okay, the next question. I've been doing this a long time, but I still feel like I'm not sure about the food. How do I get help? Well, you're on this webinar because you're working with somebody in Cecilia Health, and chances are it's a dietitian, and they are a great source of information. You can also talk to your provider and tell him your concerns and see if he can put in a referral for you to work with a dietitian out of their office. Okay, looks like there's one more question. When the doctor talks to me about my tests, I really feel like I don't understand what he's saying. What do you suggest? That you explain to him that you really want to understand this, and he needs to explain it if he's, you know, not talking to a medical professional. He needs to talk like everybody else talks. And don't hesitate to ask questions. And if you're, you know, can you explain that to me again in a different way?
Thank you so much, Nanette, for walking us through the diabetes and CKD webinar. And just like Nanette said, if you have additional questions, please do reach out to your coach that you are working with right now. Here on our next slide, we have a list of our webinars that we do have coming up here. We did include everything for June and July that focused either with chronic kidney disease or with the diabetes. So please do be checking those out. If you have any questions, please again reach out to your the educator that you're working with, and they'll be able to answer any questions that you may have about any of those programs as well. And as always, you can feel free to reach out to us on our Cecilia Health website. We are also on Facebook too, as well. But I just want to thank everyone again for your time tonight. Thank you for, yeah, being open to this conversation, and I just hope that it continues as well. So thank you, everyone, and have a great rest of your evening. Take care. Bye bye.